Just as undernutrition compromises immune system health, so can overnutrition that causes obesity. People who are obese are at increased risk for developing diabetes, cardiovascular, and immune system disorders. High intake of saturated and trans fats negatively affects the immune system, whereas increasing intake of omega-3 fatty acids, found in salmon and other oily fish, reduces the risk of developing certain autoimmune disorders, such as rheumatoid arthritis. Rheumatoid arthritis affects the joints but is more severe in terms of pain and swelling than osteoarthritis. It can begin as early as age 18. Nursing assistant interventions for osteoarthritis also can be used to help manage the discomfort of rheumatoid arthritis. Autoimmune disorders cause the body to view parts of itself as foreign, mistake those parts as pathogens, and launch an attack against those parts. It can affect certain parts of the body like skin, joints, or a specific organ, or it can affect the entire body. In the digestive system, it can cause food intolerances, celiac disease, or irritable bowel syndrome. This slide and the following 5 slides outline the common chronic conditions of the immune system and related interventions. Asthma. Definition: airways become swollen and narrowed in response to an environmental trigger, making it difficult to breathe. Severe asthma attacks can be life-threatening. Symptoms to report: increased shortness of breath during activity or at rest. Specific interventions: avoid triggers specific to the affected person. Encourage activity as tolerated between asthma attacks. Obtain emergency assistance for severe asthma attacks. Type 1 diabetes. Definition: the immune system attacks the pancreas and reduces the production of insulin. Symptoms to report: excessive thirst, hunger or urination, confusion, or hot, dry, or cold, clammy skin. Specific interventions: encourage low-carb and low-fat diet. Promote activity as tolerated. Monitor feet and skin condition daily, and immediately report any skin breakdown or signs of infection. Leukemia, lymphoma, and other immune system cancers. Definition: ineffective white blood cells elevate the risk for life-threatening infection. Symptoms to report: fatigue, weakness, or signs and symptoms of infection. Specific interventions: diligent hand hygiene and infection control practices. Wear full PPE if indicated. Human immunodeficiency virus, HIV. Definition: the virus attacks white blood cells that identify pathogens in the body, and they are no longer able to fight infection. Symptoms to report: fatigue, weakness, or signs and symptoms of infection. Specific interventions: diligent hand hygiene and infection control practices. Wear full PPE if indicated. Thyroid disorders. Definition: as the thyroid is attacked by the immune system, the regulation of hormones that control metabolism, energy levels, body temperature, heart rate, and appetite are affected. Symptoms to report: increased fatigue or cold intolerance, or changes in appetite or mood. Specific interventions: provide warm blankets and socks for clients with cold intolerance. Manage room temperature and environmental stimulation for clients with heat intolerance. Multiple sclerosis, MS. Definition: the immune system attacks the protective sheath around the spinal cord, causing disruption of signals from the brain to body parts. Functioning can vary from day to day. Symptoms to report: decreased mobility or cognition. Specific interventions: manage environmental temperature as appropriate, because it can trigger symptoms. Assist client with activities of daily living as needed. Monitor mobility to reduce safety and fall risks.